We constructed a research group that now involves 25 intensive care units in France.
Fellow Homo sapiens, in this week's Epilepsy Sparks Insights podcast, critical care/ICU physician Stéphane Legriel tells us about the ICTALGroup, an organisation formed of neurologists around France who share their knowledge to improve the care of people experiencing status epilepticus, which is an ongoing, very dangerous epileptic seizure.
Hello, Torie. I'm very happy to be here with you. So I am a critical care intensivist. I live in France, near Paris, at Versailles Hospital. It's a public hospital, and we have a particular interest in patients with epilepsy and a particular form that is Status Epilepticus.
So what do you actually do for people with status epilepticus?
We manage them to help them be in a good health. So when they demonstrate a particular form, so status epilepticus, we manage them in the intensive care unit. But I have also colleagues that manage them in the emergency department or in the neurology ward. So all the medical and nurse community take care of the patient who demonstrate this type of complications. But this is one part of my job. I have also another part that is to perform research and teaching in the neurocritical care field, and particularly, so now I think you know it about status epilepticus. So with colleagues, we have built something that is called the ICTALGroup. It's a non-profit organization of healthcare workers, medical and nurses, and the goal of our organization is to perform research and teaching in the neurocritical care field.
Just for people who aren't familiar, ICTAL is like the sort of clinical medical term, obviously, for seizure. And can you tell us about ICTALGroup and how many people are involved? How did it start? What are the plans?
Oh, it's a long story. It started in 2013 with two very nice colleagues. We created this group, and for maybe 5 years it remained a little quiet. We had local activity, not very developed, and in the second time we thought it was important to use this group to develop our activity. So we constructed a research group that now involves 25 intensive care units in France. So we have colleagues, physicians, nurses who work with us about this strategy of research, and we also perform teaching about EEG for the intensivists.
When you say about EEG, are we talking about regular stereotypical EEG? Are we talking about intracranial EEG? Which types, or both?
The EEG we perform is continuous EEG. So it's something very important to manage the patient in the ICU, because we have to record, to identify if there is an ongoing seizure activity when we manage them. But it's very important because it's not very familiar to the intensivists to use these devices. We used to monitor cardiac activity, oxygen delivery, blood pressure, but monitoring EEG is not very common. So in our group, we try to teach to the physician and to the nurses the use of EEG as a tool to monitor the patient as we monitor cardiac activity. It's very important for managing patients with status epilepticus or some other condition with neurological failure.
Actually, you're just making me think of a friend of mine who went into status epilepticus a good few years ago, and she was in A&E and I was there with her. She was unconscious, but they were not monitoring her neurological activity at all. They were just looking at her, circadian rhythm, or like monitoring her heart, and that was it. And I think, gosh, she could have definitely benefited, I imagine. I mean, actually tell us, why does monitoring EEG activity, how does that help you in stopping a seizure? How does that help you know what to do? And how would that have benefited my friend, for instance?
So just about your story, it's very important. Not all hospitals can use, they can use, but they don't have the devices. So it's very important. And the healthcare worker have to learn how to use it. But it's important because you can identify if there is an ongoing seizure, you can give the treatment, you can give other treatment when it's not very controlled. You can manage why the patient does not recover. Maybe you have to perform other exams to understand why, if the EEG is okay, why the patient does not recover. Maybe there is an overdose of the anti-seizure medication. There is a lot of things that can be used when you have this supplemental information. It's very mandatory.
What type of training are you going to provide in the ICTALGroup?
We performed a teaching program for EEG for the bedside physicians and nurses. So we give a course of basic patterns of electroencephalography in the ICU. So we teach how to read an EEG for our colleagues. That was our main activity.
What are the plans for ICTALGroup? What are you seeking to do?
So teaching is one of our activity, but we have a strong activity of research. This is probably our main activity. ICTALGroup is a critical care research network. So there is 25 ICUs in France. We have a registry about status epilepticus, that is convulsive or non-convulsive, but also psychogenic non-epileptic seizures. So we collect data about what happened to the patients, their history, management of status epilepticus, complications, how we manage them, and how they are after status epilepticus and after hospital discharge. So the registry is a modular structure. There is a core of data that allow us to record data about status that are mandatory, and we can perform a lot of satellite studies according to the point of interest we can identify. And this is very important to identify point of interest to develop strategies for improvement for the patient. It's a lot of epidemiological studies we do.
The collection of all this data which you share, you learn from all of that and how to improve treatment for people experiencing status epilepticus in the future.
Exactly.
Okay.
We work about prognosis of the patients, what are the determinants of outcome. We work about complication in the ICU. Some patients demonstrate cardiac complications that can be related to status, to other things, but also to status. They can develop hepatic complications. There is a lot of things to do, to study, to identify what we could do better to give a better management for the patient.
This is really cool. Do you know what I wonder sometimes? I only know personally, which I've mentioned in other episodes, that I've experienced focal status epilepticus before. But I wonder if lots of patients may have experienced status epilepticus and they just don't know they have, because they come out of it naturally, luckily, but they don't know that it's happened. You know, so because people only know if there's somebody observing the status epilepticus.
It's difficult to respond to this question because theoretically, status epilepticus is a seizure that will not stop spontaneously.
At all.
But sometimes a simple seizure that is not status epilepticus can be longer than usually and can reach the time of definition of status epilepticus, and it can stop spontaneously. It's because status epilepticus is an epidemiological definition to take care of most of the patient, but there is exceptions. So to respond to your question, Torie, I will say that if the patient has status that stops spontaneously, it's not really status. It was a seizure.
Even if it continued for 15 minutes, you would not classify that as...
Everything is possible. So it can be a seizure that is very long, and sometimes it can stop spontaneously, but I don't think we could consider it as status epilepticus in this case.
Okay, cool. I didn't know that. I know somebody who unfortunately does experience status epilepticus a lot, and there's a treatment he has at home which is provided to him.
Yes.
But I suppose all your patients tend to be admitted to hospital first of all, do they? Or do you sometimes have patients actually? I mean, as part of ICTALGroup, would you be studying or collecting information about patients only who have been admitted to hospital, or also people who experience status epilepticus outside of hospital?
You're right, Torie. We only study patients who need critical care management. It's a potential bias in our data collection because only 30% of patients with status epilepticus come to the ICU. But there is other teams that work to larger population of patients. We are intensivists and we are focused on patients with a need for critical care management. But we also have an interest for post-intensive care management of these patients. About the long-term outcome, what occurs to them after ICU discharge.
Of course, that's really important to take into account, because then you can sort of, I suppose, more effectively assess the effectiveness of the treatment they've received at the hospital.
Yes, the effectiveness of the treatment for stopping status is important in the ICU, but after this, the patient has to become ambulatory, to recover his previous life,
yes,
to be independent, to do not have complications, impairments, disabilities. So it's very important. And disabilities after status epilepticus not only depends on status, it can also be related to the ICU management, the treatment we use, about the disease that is responsible for status epilepticus. In some patients with epilepsy, status epilepticus is a complication, but in other patients, status is only a symptom, just like in patients with stroke or brain injury, or sometimes even toxic poisoning. So there is a lot of conditions that can lead to status epilepticus, and the outcome of the patient depends on all of these elements.
So all of this stuff is recorded in all the different places that you've got in France at the moment. But I believe that you want to expand this around Europe and the rest of the world through ICTALGroup.
Our first thought was to stabilize our own data collection, to have a good group for working together. But it would be interesting to compare management across different countries, across different healthcare systems. So it will be important in the future to make connection with colleagues and to work together about status epilepticus in different types of organization.
So if people would like to learn more or get in touch with you about ICTALGroup, I mean, what should they do? I mean, I will put the links on the website, of course, but...
Okay. Yes, we have a website. We try to communicate about our organization in social media, and we have a website that is easily to find. It's https ICTALGroup.org, and we have a contact form, so we can be contacted by this way. And everybody that is interested by working with us, we are open to collaboration, to discussion, to better identify how we could work better to understand more this disease and to give better care for the patients.
Thank you to Stéphane for founding and sharing with us the cool ICTALGroup and his plans to expand internationally. For any clinicians and researchers, you can contact Stéphane via email or via social media. The links are on the website.